As I came in, one of my colleagues left in tears because it's been such a horrendous night.
I had a little cry in there. I'm a critical care nurse. I've just finished 48 hours of work.
Overworked and overwhelmed. Caring for COVID patients might be their job, but for many NHS staff, doing just that has come at a price.
You don't stop to relax. It's very hard to sleep. A lot of my colleagues are having nightmares.
I am beyond tired. One of my consultant colleagues said that, Dave, our staff aren't tired anymore, they're wounded.
That was critical care nurse David Carr at the height of the second wave. Today he's at home and he told me he's broken.
I'm currently off sick, I'm just exhausted. And I don't know whether I'll work again as a nurse. I feel guilty the second I wake up and I'm not at work. I feel guilty, I feel anxious all the time I'm not in work, and I feel I really don't want to go to work at the moment.
So David could soon add to the number of nursing vacancies, believed to stand at 50,000 even before the pandemic. Staff shortages and excessive workload are being blamed for an emergency level of burnout, according to a report by MPs now calling for reform.
The fundamental change we need is to reform the way we decide how many doctors and nurses to train for the future. Because despite the efforts of many people over the years, we still don't seem to get this right. So we're proposing a complete overhaul of workforce planning.
When you come up later, you'll be able to have a nice cup of tea and some lunch. Oh, that's all right.
Burnout doesn't stop at the hospital door. And now care homes too are finding pre-existing staff pressures exacerbated.
Some people feel after Brexit that there isn't a future for them in the UK. So we're really concerned as to where that new cohort of staff are going to come to be able to assist these burnt out carers that have worked so hard throughout this pandemic.
Care home bosses criticise a lack of support for their staff and a lack of funding to pay them more. NHS staff have been offered a 1% pay rise, although it's been widely derided by workers. And those on the front line say today's report highlights the extent of the problem.
We need to make sure we make plans in place, put plans in place to ensure the health of the nation is not compromised any more than it already is. The most efficient and economical way of doing this is to try and maintain the staff that we have and in some way recover them, rehabilitate them, restitute them.
The government said in a statement, we recognise the pressures that staff have faced during this time, and the government is doing everything it can to support their well-being. They answered the call during an unprecedented crisis. Now, can they be helped? Tessa Chapman, 5 News.